take it away.
All right, so I'm going to talk about intervertebral disc disease, specifically in Dachshunds. It's a topic of interest of mine because my family owns many Dachshund and Dachshund mixed breeds, so it's definitely something that we have to look to prevent. So, intervertebral discs are just like cartilage-made discs that are found in the vertebrae, between the vertebrae and the spine, and IVDD occurs when one or more of these discs are suddenly ruptured or protrude over time. So there's two types. There's Hansen type 1, which is this one in the middle right here. That occurs, it's acute, sudden onset because of when a disc is herniated or ruptures. It causes this nucleus to spill out into the spinal cord, and then it causes compression. And this usually occurs in smaller breeds and usually middle age. This would affect breeds like the Dachshund. And then Hansen type 2 is actually this one over here. This affects more larger breeds and occurs between ages 8 to 10. It's actually a progression of protrusion of that disc right there, and it also causes compression of that spinal cord. And then localization of IVDD is there's either cervical IVDD, which occurs in the neck region, causes stiffness there and forelimb weakness. And then spinal IVDD occurs anywhere in the lumbar or thoracic region and can cause paralysis or weakness in the back limbs.
Okay, I got a question now. Type 1 you said was acute?
So yes,
It
type
kind of
1
like
is
the
acute.
dog is a normal and all of a sudden boom.
Yes.
And then type 2, is that more chronic and slowly progressing? Is that what?
Yeah, so type 1 is going to occur in smaller breeds where they can injure themselves from jumping from a large height. So it's acute, so it'll just be a sudden onset.
Oh, okay.
While type 2 is, it's not really found a lot in larger breeds, but it can happen, and that's a slow progressive protrusion.
Okay.
So the Dachshund, this is actually my Dachshund. He's passed now, but we had to worry about him specifically with developing this because he eventually got kind of a sway back, and then he also had a congenital kind of birth defect. So we really worried about him jumping from heights, so we tried to keep him from that. And but it's always with any small breed like that, you can develop IVDD. The Dachshund is classified as a chondrodysplastic breed, which is any breed that is predisposed to cartilage maldevelopment or cartilage damage disorders. And they are also breeds that are short-legged and usually that have longer backs. Other breeds that are affected are like the Pekingese, the Beagle, the Corgi, the Bulldog, or the Basset Hound.
Okay, so then when a dog is no longer with us, we say they crossed over.
Yes.
I learned that this summer at an animal rescue place.
And then just looking at how the breed has changed over time with 100 years of selective breeding, you can see that the Dachshund has kind of become a longer breed and with a little bit shorter legs as we kind of favor those traits. They're cute and stuff when they're a little short and stocky. So it definitely changed. That we have seen an increase in cases of IVDD. And then symptoms, irregular gait, arching of back, muscle spasms, crying when picked up or held, an inability to walk, incontinence and stiffness in back. That's actually my sister's little Cellini. He's a stinker. And then diagnosis, so oftentimes we'll do an x-ray of some sort. They might do an initial x-ray just to see if there's any other traumas to the back. There's lots of different disorders that can relate to the spine, so we have to kind of rule out some things. There could also be tumors on the spinal cord that can cause these problems. But often they do a myelogram, which is injecting a special dye into the spinal cord. This will be done under general anesthesia. And then using radiographs, they can detect herniated discs. And then we can also use an MRI to look at the nerve roots, the spinal cord, and the intervertebral discs. So treatment, if it's mild, we can go with kind of a conservative treatment. So anti-inflammatories, steroids, definitely using muscle relaxers like diazepam, and then restricting some of the activities. So not letting your dog jump off of heights and kind of going easy on the activity outside. In severe cases, we will need to do a laminectomy, which is to decompress that spine. So we remove a portion of the lamina, which is the back portion of the vertebrae, so this portion right here, that's covering the spinal canal to open up that space. So then we can go in and remove that herniated disc material, and then adipose tissue is pulled out from underneath the skin to cover that kind of empty space up. And then IVDD reoccurs in about 50% of patients, so it's definitely important to follow up with physical therapy and prevention afterwards. So physical therapy, there's lots of different options. Acupuncture and electropuncture are very popular. Electropuncture is just delivering little electrical pulses to that site of where the surgery occurred to reestablish those nerve connections. Massaging will help to improve the circulation. Swim therapy and water treadmill therapy are great ways to kind of get the weight off the dog and let them walk with ease, and that can help build up muscle. Laser therapy can help to also reestablish some of those nerve connections, and then these, they're called Cavaletti poles. They're just like small little poles that are off the ground just about a few inches. They're not meant for the dog to jump over or anything, but it's just for stepping over to kind of regain that coordination. So CRUSOE, the celebrity dachshund, he's one of my favorite animals to follow on Instagram and Facebook and stuff. So I follow a lot of his videos. His owner kind of dresses him up in cute little stuff, and he does all these cool videos. So I'll show you just a quick little blip of that. So this is CRUSOE.
Looks like he's acting, you know, the part. He's, oh my God. Oh, a speedy car.
So that's CRUSOE. So unfortunately, even as a celebrity, a show dog, and you're even well taken care of, unfortunately, he developed IVDD, and about a year ago, he had an emergency surgery in which he did the laminectomy, and then this is just kind of a video following up all of his physical therapy. So he used quite a bit of different options.
Okay, side to side stretches. Interesting.
This is that electroacupuncture.
This is the electro.
I didn't talk about this one, but this is a wobble board. So, using kind of slight movements to shift the weight of the body to, activate different muscles. Definitely want a well-trained dog to do that, because I don't think my dog would sit on that though. But these are those Cavaletti poles.
Wow. Now, do you know, did he have one disc that was?
I actually don't know.
Okay.
I think it was one disc, but I'm actually not sure.
Yeah, and it's kind of hard to tell. It's like almost like right where the thoracic vertebrae go into the lumbar vertebra, but.
And so he actually started his physical therapy a little bit, I think it was like 5 days after surgery. His owners actually physically moved his legs for him to kind of get him used to that motion, get him walking a little bit, and they actually upgraded him to a sling so they could put under his rear and lift his rear up so he could still kind of move his legs but not putting all that weight and pressure on it. And then eventually he kept building up. So I think this took about a few months to accomplish for him to get all that strength back, and now it's been about a year, so he's actually doing pretty well.
But yet there's like a 50% chance that it'll happen again. Now, what is it? Does it happen at the same spot, or a new spot? You know what I mean?
So I think it happens at a new spot
Yeah,
because
okay.
they've taken away that herniated
Yeah.
disc material. So it would definitely, and if you think about it, the pressure that they put on their back, any of those areas could be affected.
Because maybe if you like do that ectomy procedure, it might make the adjoining vertebra a little weaker. I don't know.
Yeah, that would be my guess.
Yeah. Mm.
And then definitely prevention is key for this disease. Don't allow your dachshund or other dystrophic breeds to jump off of heights. Keep them from jumping off of porches, furniture. Pet stairs are a great way to help them, or pet ramps. There's actually a brand called DACHSHUND. But my uncle built a set of stairs for my dachshund at home because she sleeps with my parents. So this helps her get up onto the bed, and we trained her using treats to go up and down. So she uses that all the time, and it's great. Also, proper weight is definitely key. Obese dogs, they're definitely putting more pressure on their back before the disease, and then definitely after the disease. Getting that weight off that dog will help them to learn to walk faster and heal faster. And then there's also this thing called Little Back Bracer, which was designed specifically for dachshunds, but they have ones for other small breeds. And this just helps IVDD patients kind of recover by giving them compression on their back and help alleviating that pain. So prevention is definitely the way to go. It's an expensive thing to treat. It's definitely very painful for your dog. So if you have a small dog, definitely look into some prevention, and definitely something easy to do is like the stairs. So.
Mm-hmm. Stairs or ramps, and I think that's a good recommendation for all dogs, because when they get older, even though they've been jumping up high or jumping down from a high spot, sooner or later things are going to start weakening in a old dog.
I think you had mentioned dogs jumping into like the back of trucks or something,
and stuff,
even
or
for like
even
larger
back seats.
breeds.
Sometimes it can be high. So yeah, I think that's a good recommendation.
All right.
Okay, comments, questions? Anybody have any experience with this? Anybody not really? Okay. I do have an idea what the surgery costs.
I actually don't know.
Laminectomy. Was it laminectomy? Is that how you-
Laminectomy.
Laminectomy? Okay, just be curious. I'm sure it's not cheap, and can any DVM do it, or would it be more of a board certified?
I would
person?
expect a board
Probably
certified,
board
yeah.
certified. Because you're right there by the spinal cord, so one slip,
$2,000 to $5,000.
$2,000 to $5,000, yeah.
Very expensive.
Mhm. So prevention would be really nice. What do they call it? An ounce of prevention is worth a pound of cure, I think. Have you ever heard that? No? You guys haven't heard that? An ounce